Good afternoon. I'm Cindy Odom. I'm the moderator for this webinar. I'm so pleased that you are here to join us today. This is a Series 1 Curriculum Assessment and Enhancement webinar, Successful Incorporation of Select A through F Topics in SRAE. Our webinar panelists today are Melissa Walther with Ascend, Lori Kirkendall with the Medical Institute for Sexual Health, Beck with the California Youth Partnership, and Nancy Capola with Public Strategies. Our first presenter, Melissa Walther, is the National Project Director for Ascend, a membership and advocacy organization representing the sexual risk avoidance field. Her work with Ascend focuses on continuous improvement of the SRAE model and supporting states and programs in implementing effective programming to help youth thrive. She also has managed a statewide collaborative of SRAE providers, together serving more than 100,000 youth each year. Our second presenter is Lori Kirkendall. Lori is the president and CEO of the Medical Institute for Sexual Health, based in Dallas, Texas. She earned a BS in Community Health Education and a MPH in Health Promotion. Previously, she led AIM for Success, one of the nation's largest SRAE education programs, and also served as a director of Life Talk Resource Center, a pregnancy care center. Our third presenter is Benny Beck. Benny is the founder and CEO of the California Youth Partnership. She has dedicated more than 25 years to education and training of students, teachers, and parents. She holds multiple subjects and special education specialist credentials in California and a master's in education with an emphasis in applied behavior analysis. And finally, Nancy Capola. Nancy is a senior project manager at Public Strategies. She previously served as a senior legislative and policy advisor at the U.S. Department of Health and Human Services, Office of the Assistant Secretary for Health, Office of Population Affairs, where she worked on projects related to adolescent pregnancy prevention and the success sequence, and as CEO of Program Reach, a nonprofit organization that provided SRAE programs in New York City. She is the author of 6 youth development curricula. We have 4 objectives for our webinar today, and at the end of this webinar, you will be able to understand the concepts of ongoing assessment and enhancement of existing curricula through the lens of select A through F topics. The second objective is you'll understand how to bring awareness to the short and long-term impacts of STIs and STDs on youth, and how youth can avoid STI and STDs. Third, incorporate or enhance skill building and curricula for avoiding sexual coercion and dating violence. And finally, understand how to incorporate the success sequence into SRAE presentations. Before we begin our presentations today, let's take a moment to review the required SRAE components. Ensure that the unambiguous and primary emphasis and context for each topic described in paragraph 3 is a message to youth that normalizes the optimal health behavior of avoiding non-marital sexual activity. Be medically accurate and complete. Be age appropriate. Be based on adolescent learning and developmental theories. And experiences. In addition to these components, the SRAE programs are required to have the A through F topics in their programming. So let's review these very quickly. Topic A, the holistic individual and societal benefits associated with personal responsibility, self-regulation, goal setting, healthy decision-making, and a focus on the future. Topic B, the advantage of refraining from non-marital sexual activity in order to improve the future prospects and physical and emotional health of youth. Topic C, the increased likelihood of avoiding poverty when youth attain self-sufficiency and emotional, excuse me, and emotional maturity before engaging in sexual activity. Topic D, the foundational components of healthy relationships and their impact on the formation of healthy marriages and safe and stable families. Topic E, how other youth risk behaviors such as drug and alcohol usage increase the risk of teen sex. And finally, topic F, how to resist and avoid and receive help regarding sexual coercion and dating violence, recognizing that even with consent, teen sex remains a youth risk behavior. So now we will shift into a presentation by Melissa Walther with Ascend on curriculum assessment.
Thanks so much, Cindy. And I am really glad to be here with all of you and a part of this learning experience. I want to start out by sharing about another learning experience that I had recently. My family and I went on a zip lining course, and this was not just any zip lining course. This thing was about 300 feet in the air, and there were multiple zip lines. One of them was nearly 2,000 feet long. And so, as you can imagine, as we're in this gear room, kind of getting ready, and we're putting on our harness and getting our helmets and all of that, we're chit-chatting with the others that were there to do this crazy adventure with us, and just trying to kind of get to know each other, sharing our feelings about this crazy adventure that we were about to embark upon. And as you can imagine, there were a few people in the group that were pretty apprehensive, pretty nervous about what we were about to do. They didn't really know what to expect, or they didn't know what they had gotten themselves into. And then there were others that were really pumped up and excited and ready to go and really looking forward to it. And maybe they had even done a few of these kind of ziplining things before. And then some of them had pretty mixed feelings about all of it. But no matter what our feelings were, we all somehow managed to convince ourselves to climb this giant ladder to the first platform and climb up onto the launching block. And when it was our turn, everyone jumped. Everyone, took that plunge. And although the nerves may not have subsided immediately, by the end of the course, everyone was at least more comfortable with it, and we were all having fun. And so similarly, I know that some of you on this webinar may not have any experience with curriculum assessment, whereas there are others of you that are experts and could probably lead this webinar yourself. And so I want to welcome all of you. We're all here because we want what's best for the youth we serve, and we're taking this step and learning more about curriculum assessment for that purpose, to really try to do the best that we can for the youth that we're seeking to serve. Also, this webinar is really kind of the launching point for this first series of products that are designed to give knowledge and more experience on this topic of curriculum assessment. So in addition to this webinar, you'll also have opportunity to refer to a tip sheet that will be released. There's going to be a cluster call and also workshops that are designed to really help us build upon this concept and dive deeper as we go. So while we have a lot to cover in this webinar, as you could tell from those objectives, right? This is really just the starting point. We want to cover the major concepts and lay the groundwork for things to come. And so with that, let's jump into it. We're going to discuss how to assess curriculum, particularly how to assess your curriculum to see if you are adequately addressing the required A through F topics. And so you're going to have opportunity to hear from 3 individuals that have lots of knowledge and experience in the SRA field and you'll have kind of tangible examples of how to incorporate these select topics into your programming. And then additionally, we're also going to look or talk about a tool that you can use to help guide you through the process. So let's start out by talking about assessment versus evaluation. There's often a lot of confusion about the difference between evaluation and assessment. Some may believe that they're assessing learning simply because they have an evaluator. And that's just not necessarily true. It depends on what that evaluator is doing. So let's define assessment. One definition that I think is pretty comprehensive is that assessment is the process of gathering and discussing information from multiple and diverse sources in order to develop a deep understanding of what students know, what they understand, and what they can do with their knowledge as a result of their educational experiences. And the process culminates when assessment results are used to improve subsequent learning. And that definition is taken from a study conducted in 2000 by Hubba and Fried. So you can see from this chart some of the differences between assessment and evaluation. Assessment is really about identifying weaknesses and diagnosing areas for improvement. Assessment gives us feedback in the process to allow us to help coach the participants and scaffold their learning so that evaluation outcomes are improved, meaning students are making better and healthier choices. So assessment is conducted during programming, whereas evaluation is typically conducted at the conclusion of the program. And ultimately, assessment is about increasing the quality of the program. So pat yourselves on the back for taking this step to participate today. You are really demonstrating an interest in improving your programming, and that's really what matters. You're doing this because you care about the youth that you serve, and that is really inspiring to me. So thank you for being here. There are many different types of assessment and many that can be related to curriculum. So depending on your role in your program, you're probably familiar with some of these. In fact, you may have been forced to conduct an unexpected assessment of your program model due to COVID and all the unprecedented changes that it caused to our way of life. You may have decided and determined that you needed to implement virtual programming if you wanted any shot at being able to serve students in this new environment, especially within the last year. And so unexpected occurrences can certainly necessitate assessment to determine if a change of course is needed. But assessment shouldn't just be a one and done task. It should occur on multiple levels, and it should be ongoing. And so through your CQI process, you might already assess whether you're meeting programmatic goals and objectives, or you may conduct assessments to ensure that you are fulfilling certain requirements of the grant. And you might also hopefully be assessing learning to make sure that students are picking up on the information you're trying to communicate to them. And so do any of you remember in school when you had pop quizzes? Those are certainly a memorable example of assessment. And your teacher was using those to really assess whether you were prepared maybe for a final exam or something that was to come that would be testing your knowledge and evaluating what you've learned. Or they may have just been simply using that pop quiz to gauge whether you were learning what they were intending or what they were trying to teach you. Either way, that's a simple example that I'm sure you all can relate to of assessment. And there is really so much information available on all of these different types of assessment that each of these could be a topic in and of itself for a webinar and fill a whole webinar. So I wanted to highlight them here just to really show that there's many different opportunities, different forms of assessment that should be conducted with intention and with planned time for completion, all for the purpose of strengthening your program and improving your program's impact on the youth that you serve. And so the purpose of this webinar and this series really is zeroing in on curriculum assessment, how and why to do it. And so as a simple example of assessment, let's do a quick poll. So Julie, would you launch that poll for us? There you go. You should see 3 questions to respond to. They're listed on the slide and also in your poll here. And we'll give just a few moments for you to respond to those. So as you're responding, the first question, we're asking how often do you assess your program? Secondly, how often do you assess your curriculum? And then third, how often do you assess your learners? And we are all at different points, so there's no right or wrong answer here. All right, Julie, does that mean the poll has ended? It looks like it's ended on my end. So we'll see if results will pop up here. Oh, sorry, Julie, you were cutting out for me. Would you? Oh, there we go. Now I see them. I see results here. It shows, it seems like most of you assess your program every year. And the majority of you, well, it's pretty even split on how often you assess your curriculum, either when you get around to it or no answer, I guess that's what it's saying there. And then 45% of you say every year. And then for the last question, it looks like 21% of you say you assess your learners every lesson or session. Some of you say weekly, and then a few of you say annually. Great. All right, thank you for launching that, Julie. All right, well, it's important to really remember that assessment is an iterative process. It's intended to provide feedback to advance students' learning. And so really assessment should occur annually at an organizational level, and that would include curriculum for things like fit and alignment to your desired outcomes of your program. And then in addition to this planned and consistent frequency, assessment should also occur when change happens. So as I already mentioned, the example with COVID causing maybe an unplanned assessment of your program model. But change can also occur anytime you're seeking to serve a new population, or maybe you're changing your delivery setting. So for example, if you have students that you've been serving in a clinic setting and you're now looking to serve them in a school-based setting, or maybe in a detention facility, those sorts of changes would mean you might want to assess your program model and intended outcomes to consider if your curriculum is a good fit for those changed populations and settings. A critical piece to conducting assessment is really documenting that you did it. You want to be able to show the decisions that were made, the measurements, the benchmarks that you used to inform your decisions. And if there's no record of it happening, did it really happen? So make sure you're thoroughly documenting your processes there. The first step in assessing curriculum is really assessing the fit. So you considered fit when you were selecting the curriculum that you would implement for this funded program. So hopefully you considered things like, is it valid and reliable for the population and the purposes of SRA? Do the intended outcomes of the curriculum align with the objectives and the goals for SRA? Things like, is the curriculum age appropriate? Not necessarily just for students' cognitive abilities, but also for their developmental and social abilities and their understanding. And then you should consider things like, is the curriculum culturally and linguistically appropriate? So just as facilitators are required to implement the curriculum with fidelity, they also need to be culturally and linguistically responsive. So they could follow the curriculum's overall approach and learning goals, the scope of activities, but they may need to modify the environment or some of the activities that are described in the curriculum to make them more culturally or linguistically responsive. And then if you're implementing programming to youth with disabilities, there may need to be additional considerations so that all youth can fully participate in the program. And then curriculum really should be implemented by qualified and trained facilitators. So training really plays a key role in the successful implementation of your curriculum and of your program. Facilitators need to be able to exhibit self-efficacy and have a belief or a buy-in on the benefits of SRA. So just as you've spent time and effort, hopefully, in identifying a curriculum that's really the best fit for your community, there's also need for effort and time to ensure that your curriculum incorporates required components and topics. Oops, I'm clicking the wrong thing there. There we go. So one way to assess your curriculum for alignment to organizational and programmatic goals and objectives or requirements of the grant is to use a rubric. A rubric is a tool that will kind of guide you through that process. So a rubric really is just the thing that provides the rule or the measuring stick by which your curriculum should be assessed. So it lists the expectations or benchmarks, the desired outcomes against the actual and what's actually occurring, what's really happening. And so therefore, it's really essential for conducting gap analysis. It helps us do that well. And it helps us answer the question of, does our curriculum cover all these required topics? So the first step in designing a rubric is really being able to identify those measurement standards. So you might want to include things like your organizational goals, and like we said, programmatic objectives, grant requirements, but it could also have things like alignment to theoretical frameworks for your programming, or alignment to the SRA conceptual models, or SRC conceptual models too. And additionally, you could include alignment to the predictors of behavior change, because those are the things that research has shown are effective at helping youth change behavior. And if you're not familiar with those predictors, there was a session on the predictors of behavior change in the last topical training. And so you can access that through the exchange. And we'll mention that here again at the end of the webinar to direct you there if you'd like more information on that. Okay, so once you have identified those standards, that benchmark, that measurement stick, then next you want to review your curriculum to identify areas that meet those standards. And in the process of doing that, you may discover gaps or areas of weakness. And I want to say that is okay. That is really the whole point of doing curriculum assessment, is to identify those areas of weakness so that we can focus some attention and time to them to strengthen that area and overall strengthen our program. So as we discussed, a rubric is really useful. It can be customized and tailored to really meet your needs. And so here are a few resources that you can check out for information on developing your own rubric. I'm actually going to demonstrate how to use a rubric for assessing A through F as we go through the webinar. But first, we wanted to give opportunity for you to hear, like I said, from those 3 individuals that have some knowledge and experience on these topics. We've selected these three required topics because we've heard that they can be challenging for some SRAE programs to incorporate. And so we want you to be able to kind of get some tangible examples of how that can be accomplished. And so first to help us with that is Lori Kirkendall, and she's going to share with us how information on STIs can be incorporated into an SRAE program. So I'm going to see if I can pass this ball to Lori. Lori, take it away. Thanks.
Yes, thank you, Melissa. Thanks for getting us started. I'm happy to take on at a very high level and a crash course of sexually transmitted infections and sexually transmitted diseases. So Medical Institute is a science-based public health research and education organization, and I'm glad to be a part of our panel today. I'm looking forward to, again, giving you a crash course, a refresher, or perhaps make a way to make this information more includable, if I could use that word, in your curriculum and more applicable to the youth that you're serving. So this will barely touch the surface of what needs to be included, but perhaps will bring to light some ideas and gaps that could be closed with some more information in this area. So on this first slide, I just want to show you, first of all, we're using STI/STD interchangeably as it in the field should be done. There's a lot of confusion and clarity. We use them interchangeably, as does the Centers for Disease Control. So you know what I'm talking about. You can use your preferred acronym there, but we use them interchangeably throughout the presentation today, just as a note. And to start off with, the epidemic in the U.S. has had unprecedented increases. You'll notice at the bottom of this slide that these statistics were fresh out in January from CDC, talking about this continued unprecedented increase. And what I find so fascinating in our field is if you watch the numbers on teen pregnancy, teen births, teen abortions, and even teen sexual activity, those numbers have declined steadily and significantly for the last 20 years, but not STIs and STDs. They have continued to go up. And so I want to make sure you're including that content as we're talking about this SRA programming. So on any given day in 2018, 1 in 5 people, that's people in the United States over the age of 13, had an STI in 2018. 68 million infections, 26 new infections. That number has gone up. For years, we've said 20 million. That number in January was raised up to that 26 million annually, with about half of them among youth ages 15 to 24. The big 4, chlamydia, trichomoniasis, genital herpes, and HPV, human papillomavirus, are nearly all of those incident STIs. And we'll talk a little bit about those infections in our high level look at them today. But we are seeing also of great concern is the highest number of congenital syphilis cases ever reported. Congenital meaning passed from a mother to her infant and should be able to be tested and treated ahead of time, but still get through the highest numbers we've ever seen. So there is an urgency here to address this epidemic and reevaluate our approach and program efforts around optimal sexual health. It's not just about pregnancy prevention. It's so much broader, as you all know in your programs. So the OPRE report that came out last June, you should be familiar with, about the benefits of delayed sexual activity. A few highlights there, clearly showing that the avoidance and delay of sexual activity leads to the avoidance of physical, mental, relational, and financial risks associated. So that includes pregnancy early in adolescence, STI transmission, living with an unmarried partner, improving reported relationship satisfaction, and increasing the chance of graduation among girls, and reducing symptoms of depression. There's a lot in that report that I would encourage you to get a hold of that. Again, broaden this beyond just the statistics related to pregnancy, but also the other physical, which we'll talk about today with STDs, and beyond to emotional, relational, and emotional and mental. So let's first look at the present, meaning current, today's impact for youth. We know that the adolescent brain tends to think short term and is most concerned about today. So these are things that can possibly happen as an impact, right, to them, that you can help translate then into information shared with them. So again, at a high level, if there are symptoms, there could be an array of physical and pathological manifestations. These are big words to say quickly with you all today, but infestations, so that would be scabies or lice, right? There are over 30 different STDs we can talk about. Some are infestations, some cause skin lesions. Those could be the painful sores of herpes, those could be the painless and sort of annoying bumps from genital warts. Infections of urethra, cervix, and endometrium, pelvic inflammatory disease, this pus and pain, as we sometimes simplify it, they can be there. Now, keep in mind that if about symptoms is really important, and I'll mention the term asymptomatic again, that youth need to understand. Most who are infected are indeed asymptomatic and will not experience these symptoms, but some do. And you can see that along with this physical impact come along emotional and mental health impact as well. We know that if a youth is infected with an STD, they could be more likely to experience the anxiety, depression, and suicidality that we see associated also with sexual behavior in the first place. There's also an impact on the pregnancy and baby's transmission. I already mentioned syphilis is there, but also herpes can be a risk. The virus can be spread to babies coming through, and there's a current risk there. And then also there's a risk associated with the sexual partner that they're involved with. What would that impact be like as they look at having the risk of transmitting it to that person? There can be relationship stress and trust issues that come along that can lead to a breakup, which we know then can lead to further partners, and that higher number of partners is the greater risk. One of the telltale associations with risk is number of partners. So we see all of these factors going on in a present sense. Our next slide looks at a future impact. This is the more long-term effect, lifetime impact that sometimes our short-term thinkers, youth, can't understand, but we, the adults who love and care for them, can be aware of and help them understand these are life-impacting decisions. STDs can lead to PID and ectopic pregnancy and infertility issues. This is why our founder, Dr. Joe McElhaney, started Medical Institute nearly 30 years ago now, was that infertility so often is seen in a young married couple trying to start their family, an infection that was obtained in teenage years without them even knowing it. There's also a number of various kinds of cancers, or as I've been asked by students before, you mean you can get cancer from having sex? Well, absolutely. There are a number of different kinds of cancers, most of them associated with HPV. Chronic illness, again, of that inflammation going on inside, stays around and gets worse over time and is very difficult to treat. The big word work incapacitation refers to days that they aren't able to work at school or work at work as they may have otherwise been able to had they not been dealing with this infection and disease. And then again, relationships and the impact there and school achievement are all impacted on a long term by STIs and STDs. Each of these bullets could grow into a whole webinar in itself, but as a high level, looking at the present impact, the future impact, and now also the financial impact, there is a drain financially on the individuals impacted and also on the families, right? So that's involving the testing and the treatment and the ongoing services needed to manage. But look at these fresh numbers again from January of the healthcare system itself, $16 billion per year in direct medical costs. So there's indirect costs well beyond that. With youth ages 15 to 24, about 1 in every 4 of those dollars. I landed on this slide, just another issue to be aware of when we're talking about STDs is antibiotic or drug resistance. That's becoming harder to treat some of these, specifically with gonorrhea. It used to sort of be thought, well, if I get it treated. It's just not that simple with some of these, as that antibiotic and the bacteria have mutated to get around them more and more. So with those things said, we kind of got to think through, how do we translate those issues, that information and impact on into the young people that we're serving every day. And there's really two key topics I want to touch on that can be incorporated into your curriculum. We'll look at risk or prevalence, helping them understand their risk. And then we'll look at types of infections, helping them understand that information in a way that is not overwhelming, but can become practical and applicable to their decision making. So first, let's look at risk prevalence. This is how many are infected each year. 1 in 4 sexually active teens is infected every year. So in public health, we talk about making statistics relevant or relative so that those who are hearing them can understand their risk. If you say 4.375 million, 26 and 32.5, no one really knows what that means. But when you translate it back to a number like 1 in 4, it becomes more real, the risk that sexually active teens are facing. So you want to think about that number. And as I say to students a lot of times, it's not a 1 in a million chance. It's a 1 in 4. And that's a pretty big number to look at. Again, those things that multiply that risk with multiple partners, multiple years of sexual activity going along the way. So this is a way to talk about their risk prevalence. The second key I wanted to look at that goes along with this idea of the prevalence is taken straight out of this older study, but it provided a nice diagram. We used this in the program that I was a part of for a number of years. Jefferson High School, that would be in quotations, a so-called a real high school that was sampled in the Midwestern part of the United States. They tracked the relationships among the students for 18 months. And if you look on this slide, it shows that graphic. Black dots represent the boys. The clear white dots are the girls. In this schematic that shows their relationships and really their interconnectedness. Of 288 students, almost half of the school was connected in some sort of romantic and/or sexual relationship. So what I like to point out to students, and you can do the very same thing with this data, or even you've seen where they talk about how quick the risk multiplies with numbers of partners and who have they been with and who have they been with and who have they been with. Well, this was a real case study done and published in the Journal of Sociology. And I like to point out to them, and if I had a pointer, I would show you better. I can't do that in the slide, but look at the students around the edges, the boys and girls who just had sex with one other person, and yet look what they were exposed to, a part of this community of network, what the research is called really a viral playground or a recipe for an STD epidemic right there in that school. So helping them think about how quickly their risk multiplies. And if 1 out of 4 sexually active teens gets an STD every year, then that means, translate the number here, right? About 70 of these are infected. So that's how risky it can get in a hurry, and why sexual risk avoidance and the clear message there makes so much sense. The second key we said about their prevalence is also just kind of how to break this information down in a way that they can understand. And this chart shows us here the difference between bacterial infections and viral infections, helping them to understand really kind of two families that break down to the microorganisms which cause them, that are spread, that you can't see, but can create these infections and difficulties. And again, deserve much more time in your classrooms, but thinking through the bacterial can be cured if you know you have them, if you've gone to be tested and to get that treatment. But even then, that damage may not be able to be undone. There can still be permanent damage, even from the bacterial curable infections. And then on the viral side, helping them understand they're treatable, but not curable. There is no cure for any viruses. There's no cure for sexually transmitted viruses. So there's a whole family of V words over there. HIV and AIDS, HPV, human papillomavirus, the most common viral STD, and you can walk them through, can lead to warts and cancer. You can help them understand the vaccination that prevents the few of those strains that are most likely to cause warts and cancer, but doesn't prevent all of the types of the strain. Helping them understand HSV and the herpes sores, the cycle there that can come and go for the rest of their life, and the hepatitis virus is there as well. I want to point out on this slide, again, all of that could be developed into your curriculum, but you'll see the 2 P's at the bottom, protozoans and parasites. That single-cell parasite for the protozoan of trichomoniasis is causing great trouble. It's actually become the most common STD, curable, treatable STD that there is, and causing a lot of problems similar to chlamydia as well. So it's kind of a category in itself microscopically, and yet the problems it's causing and the antibiotics needed to treat it are worth being aware of as well. Of course, pubic lice and scabies, no one really likes to talk about some of these things, but they're real risks that our young people need to understand. So that's a high level on the kinds of infection. A little bit more here in our time we have today is just a couple of these topics. I mentioned earlier the first one that young people need to understand, and I'm glad if there's one thing good we can get out of the COVID pandemic would be an understanding of asymptomatic infection. So for years, I've taught this word to middle school and high school students, asymptomatic. You see the word A at the beginning, or the prefix A means no or not, followed by that big word symptomatic, so that's a symptom. These are people that have an infection, but there's no signs or no symptoms, yet they're still contagious. This is a concept our young people can better understand in 2021 today. So also with sexually transmitted diseases. So most are asymptomatic, still can be contagious. Someone can give it to you without them knowing they even had it. Now you have it and don't know you have it. And yet internally, those kinds of problems we were discussing on the present and future impact could be there as well. Second point, again, deserves much more development, is talking about the effectiveness and ineffectiveness of contraception. Most of that comes down to a need to understand the mode by which, the way those diseases are spread. So some are spread through fluid, more likely the bacterial infection. Some are spread through skin-to-skin, body-to-body contact with the sexual area of the body. That would be like the herpes lesions and HPV. That mode of transmission effect is related to how effective a contraception would be, or a pill in your mouth or a shot in your arm doesn't provide any protection from STDs or STIs. So now we're looking at barrier protection, which can help with better with some of the fluid STDs, not as well with the skin STDs, because they simply don't cover all the skin in the sexual area of the body. Helping them understand the difference between the terminology we use, between risk reduction, reducing, making less, versus risk avoidance, avoiding, making none, the risks of STDs by avoiding sexual behavior. And it's important to talk about the gamut of sexual activity. We're not just talking about intercourse here, but if there is skin contact made with the sexual area of the body, they are at risk for these STDs and STIs. Along with physical risks come emotional and relational risks you may be aware of. I've heard several stories of married couples who brought a herpes infection into their marriage, and the relational and emotional side of that, that's even worse than the pain and discomfort they feel during those outbreaks. All students need to be taught the importance of testing and treatment if they've ever had sex before, are currently sexually active, to follow the recommended guidelines for testing and screening. That's part of understanding their risk. If they have something, we want to know and get it treated earlier on and begin to manage and deal with it appropriately. So then my last slide is a couple of recommendations. I think we've already made several through this segment, but first of all, we know that STD and STI information is inclusive of all students. As you're thinking about the messaging, they need to understand that the risks of STDs and STIs are there for all, regardless of sexual experience or sexual orientation. Or as I have said in classrooms before, STDs don't really care What's your sexual orientation or sexual experiences, whether you've had sex before or not, or whether you chose or it was forced upon you. We're talking about your future and the choices you make from here on out. And STDs are looking for skin to skin, body to body contact, exchange of fluids that allow those STDs to be transmitted. And then a second recommendation is just to ensure that as you're presenting this content, to be sensitive and emotionally supportive of those who may currently be infected and dealing with some of these very symptoms and issues that we've talked about today. So they need to absolutely be in there getting tested and treated and cared for along the way and choosing risk avoidance from here on out. We know risk avoidance is a decision about your tomorrow, not a decision about your past. And so we help them understand today going forward, they can avoid the risks further to themselves or to any partners. And then always the best part of our job is offering future orientation and hope to this category of students who may be dealing with an STI or STD, but really to all of the students there. And I was on a session earlier today where we were talking about, students don't like to be told what to do, or they're, they don't want to be judged, they feel judged. And I just was thinking about, if you have a friend, and you could use this certainly with students, if you had a friend who had diabetes and was overweight and had 6 bags of potato chips to eat for lunch, you're likely to say, I don't think you should eat another bag of potato chips. You should eat this apple instead, as an extreme example. But you're not saying that because you're judging your friend. You're saying it because you care for that friend. This is a message of compassion to protect them and want the best for them, and getting comfortable with that kind of information that allows them to avoid those risks, I think, is really important. This is a crash test, not a crash test, a crash course. I won't give you a test on what we've covered today, just to be available to add additional information and resources around this topic. I'm glad for the opportunity we've had to include it today. I do think a lot of the SRA programs are wanting to bolster this topic, particularly given the new statistics. So I'm going to pass it back to Melissa and allow us to continue on in the webinar. Thank you all so much.
Thanks, Lori. We'll give it just a second. There we go. Thank you very much. Okay, so really quickly, I just wanted to come back to talking about how a rubric can be used to assess your curriculum to see if you're addressing STIs. And so again, there are many templates and samples for creating a rubric. This is really just one very simple example, just for us to be able to discuss the process. So really using a rubric is guiding us through a process of documenting all instances where you can prove that your curriculum is addressing this topic of STIs. So my oldest son plays lacrosse, so I feel like I'm constantly telling him to take a shower. But he's also the type of person that may rush through just to be able to say he did it. So I find myself smelling his hair a lot to see if he's really clean. Like, that shampoo smell is the proof that he showered well, right? And so similarly, a rubric can help you document and give the proof. You can't just say that you're addressing STIs or that you're addressing all the required A through F topics. You really need to be able to document the proof. And so this rubric is a way to do that. So you can see on the left here, the grant requirement showing that the goals of SRAE are to empower participants to make healthy decisions and provide tools and resources to prevent pregnancy, STIs, and youth engagement and other risk behaviors. And then on the far right, in this made-up example, you'll see that there is a lesson listed. So there's a lesson in this made-up curriculum on sexually transmitted infections, and then it lists the objectives of that lesson there as part of the documentation to show that STIs are incorporated. So that's, like I said, a very simplistic example, but just helps us to kind of get comfortable with this idea of using a rubric. And so we're going to move right along. We're going to hear from another SRAE expert about incorporating consent and dating violence into SRAE programs. And so I'm going to hand it over to Benny Beck from California Youth Partnership to share what that might look like in an SRAE program.
Hello, everyone. Thank you, Melissa, for the introduction. And for the sake of time, we're just going to go right in. I almost feel like we need a brain break because we've listened to some great information. So if you need to stretch while you listen, please help yourself. All right, I am going to move through my slides here. When we're talking about this topic, consent and dating violence, I notice that it's very popular these days for people to teach students that consent is everything. In an SRAE education, it is essential that we frame the teaching of consent around the age of consent law for each state. So I am going to see if any of you are familiar with that. Here's a poll. You should be seeing it right next to your screen. Since this is a quick poll, we may not take all 5 minutes, Julie, but it's up to you.
We'll close the poll out in approximately 20 seconds.
Great.
Results have been posted.
Okay, great. So it looks like 50 out of 125 people on this call are familiar with it, and there are those not sure. Okay, great. Well, this is a great opportunity. Those of you who are already familiar, you can go and check it out anyway and make sure that your information you have is current because it does get updated every year. And those who are not familiar with it, here's a great resource, a link that you can go to find out what the statutes are for your own state. Why do we need to know this? It's because then your students, as I will further show you, that you will be able to answer the questions that your students might have. As an example, since I'm from California, I am going to share the California Age of Consent Law of 2021. So basically, the age of consent is the legally defined age at which a person is deemed legally competent to consent to sexual activity. The California age of consent is 18 years old. So that means teens who are not under 18 years old cannot consent to participate in sexual activity. And if an 18-year-old or older participates in a sexual activity with a minor, 17 or younger, they can be prosecuted for statutory rape. Wow, what a big legal ramification. So now you understand why we need to cover this area, because having consent and having contraception is not a green light for teen sexual activity. Ooh, my slide is not advancing for some reason. Okay, there you go. So it's powerful when you can show a legal penal code. Our effort, of course, is not to scare them, but to share with them exactly all the information they need to know to make a healthy decision for their future. So I go over this with them. And when you do that, it's super important that you bring examples that they can relate to and that's relevant to them. So here's some 5 situations that you can share, but I'm just going to take one. A pair of high school sweethearts who've been dating for 3 years decide to have sex for the first time. And the older one is 18 years old and the younger one is 16. Well, still, the 18-year-old is over 18, so that person can be prosecuted for statutory rape because the partner was 16 years old, who is a minor, and they cannot give consent to sexual activity legally. And so as you teach this, I do suggest that you do a little bit more research, because there are a lot of other details and statutes that go along with it. So when you're sharing this information with kids, you will definitely get reactions from your students and their eyes will get big. So you want to be able to answer a lot of those questions properly and accurately. So when we approach and talk about consent, dating violence, sexual coercion, these are very sensitive topics, especially for those at-risk kids. So we need to take a holistic approach and really let them know that some of these skills they're going to learn is transferable from any relationship, from school, love, life, work, in all situations. So helping them to identify healthy and unhealthy attitudes and patterns. What are some red flags in power and control behaviors, to really empowering them to practice and build refusal skills is so important. One topic that comes over and over when I work with students is that some students who are sitting in the classroom have already complied to sexual activity, and it may not have been their choice. So it's important to teach them that compliance does not equate consent, and that we are here to teach them skills so that they can avoid situations where they have to comply, so that they can develop safe relationships. One example activity that I love to do with students is to give them bullet points of some attitudes and different characteristics. So I have these two sections, and then I ask the students, so what is the difference? Tell me, what is the biggest difference? And oftentimes students will tell me that the biggest difference is that they can see that on the left side, that it is healthy and it's more mutually beneficial. And the right side, the unhealthy side, is more self-centered and selfish. So that's a great concept to walk away with for students. And the last one, on the unhealthy side, isolation, I really unpack that, because it's so often I hear students say, well, my boyfriend always is jealous and wants to know where I am all the time and wants me to spend only time with him is because he loves me so much, or vice versa. A guy may be sharing that. And I tell them and really unpack, actually, that's a red flag in a relationship for power and control. So let's talk about some of that. So it's really important that you help them process this information. When we talk about sexual coercion, I would say two words to focus on with students is non-physical pressure. This is a non-physical pressure, and it happens in a continuum. It could start in a friendship where you're just, somebody starts to egg you on and start calling you names, making you feel guilty, all the way to drugging somebody and introducing alcohol, getting somebody drunk to obtain sex. So there's a wide continuum, and the skills that you're going to help them build is really going to be transferable. If you go to this website that I'm sharing with you, womenshealth.gov, and click relationships and safety, you will be able to find situations and phrases that students could really relate to. So again, relatable and relevant for our students is important. So here are some 4 bullet points of situations where they might find themselves in, and somebody may be telling them, lying or threatening to spread rumors about someone. So that's a situation that's very coercive. And other examples to share is powerful. So these are some statements or phrases they may hear. If you go to this website, actually there's so many different ones. You can, give a few of them in groups. You can just break this in a very fun game kind of way to unpack for the students. I asked some 7th graders a while ago, and I had them get into a group and talk about what coercive statements have you heard. And I'm going to share 4 with you today. And once they share this in a group, it always surprises me how even 12 to 14-year-olds will come up with so many coercive statements that they've heard. And then give them an opportunity for each person to share and respond. And it is so wonderful to see them talk about all the stats and facts that you've shared with them, and they get really empowered and become confident to share this. So one example is, if you really love me, you would do this. If you really loved me, you would not pressure me to do something I don't want to do. Or it's safe. I have a condom. According to CDC, a condom does not protect you 100%. I want to avoid all the risks. It's so cute when I hear them say things like this. So again, transitioning into consent and coercion to dating violence. Dating violence can take place in a form of physical, sexual, emotional, or all 3. And it's all about power and control. So it's important to help these students to realize that dating violence is never the fault of the victim, or it's never their fault, and that their safety is most important. Because what happens is, I often hear students will say, well, I didn't feel right, something was wrong, but I didn't want to hurt the other person's feeling or misunderstand. My advice is that their safety is most important, that they need to find a safe way to get out of that situation and bridge the relationship later, even if they were wrong. So that's an important fact to go over with them. Dating violence is, again, about power and control. This is a power and control wheel for dating and intimate partner violence. And I love the way DVAC, this organization, has put together all the words that teens could really relate to, and how it's broken down into all these ways that it can take place. So again, it's important to tell the students to find a safe, trusted adult to talk to them about, and that they're not alone in this situation. And it's really about giving them, building refusal skills in them so that they can avoid these situations in the future. So you have to stop and ask yourself, is your curriculum addressing these things? And, what are some ways that you can provide these facts and these tools in a way that they can understand? One way is to share this, but you can also bring a guest speaker who can share their story, or you can do storytelling of a situation. So those are some impactful ways that you can do it with them. It is also important that we not only give out national resources to our students, but we also give them and talk about resources that they have at their fingertips, like school personnel, parents, guardians, safe people that they can talk to, counselors, or if you have local organizations that you know of that they can just call right away or make an appointment. These are all wonderful assets that you can share with your students so that you set them up for success. I think that is all for now. So I'm going to turn the ball over to Melissa. Thank you for listening.
Great. Thank you so much, Benny. All right, really quickly, I want to bounce back again to this rubric idea. And again, these are all sort of made up examples of curriculum. over here on the far right-hand corner. But if you look at the rubric, there are the grant requirements, the required topics are listed there on the left-hand side, and then the proof, like we talked about, is listed on the right in the right-hand column. And then you'll notice in this example that in this middle column, there are some notations of maybe missing content or areas of weakness. And again, that's the point. That's why we do these assessments. And so there's no need to freak out or stress out if you have missing content or area of weakness that you've noted. That's really just an opportunity for us to strengthen our program even more and continue to get better and better. So that's really the point. No need to stress. I also just want to make sure that that I encourage you, if you're using a published curriculum and you're going through this process of assessing to see if you're addressing these required topics, if you notice an area of weakness or missing content, or even actually before you start the process of assessing the curriculum, make sure that you're using the most updated version and not using an outdated version of the curriculum. The publishers are constantly seeking to improve also and do the best they can. So there may be a newer version of the curriculum that's addressed maybe an issue that you were questioning or that you didn't find thoroughly addressed. So make sure you're talking with your curriculum publisher, and if you identify areas of weakness, it's another opportunity to talk with them about that also. They want to hear those things. So stay in close contact with those folks. Okay, I'm going to hand it over now to Nancy. She's going to lead us through some information on the success sequence and how the success sequence can be incorporated into your SRAE program. It should be coming to you, Nancy. There you go.
It is. Thank you, Melissa.
Thanks.
Let's go the right way. Okay, so I want to talk a little bit today about the success sequence and how incorporating the success sequence into your program can really make a difference for the youth that you serve. And so the success sequence is a term that's really gained a lot of currency in discussions related to reducing poverty and helping adolescents and young adults to achieve self-sufficiency when they reach adulthood. And the most widely cited research on the success sequence was conducted by Haskins and Sawhill, who popularized the term back in about 2009. And it really refers to a series of milestones in life that are associated with escaping poverty and joining the middle class. So we can see here on the slide that the most common definitions include finishing high school, getting a job, getting married, and then having children. So it is really about this waiting until after marriage and after having financial stability to have children. And the milestones are described as a sequence in order to emphasize the fact that order does really matter here. And in fact, young people who adopt these behaviors and follow this sequence have only a 3% chance of living in poverty. Over the years, numerous researchers have looked at the survey data to compare families on measures of poverty and middle class status. And these studies really provide us with some correlational evidence that families that meet the definition of the success sequence and those milestones have lower rates of poverty and higher rates of middle class status than those families who do not meet the definition. Wang and Wilcox more recently studied millennials to see if the data holds true for this group. And what they found was that even among millennials who are delaying marriage and parenthood, they classify those who have not had children by the time they reach marriage as on track. And so similar to their peers who followed all 3 steps in the success sequence, those who are on track, 92% of that group had come out of poverty. Wang and Wilcox also found that there is a sharp contrast in economic status between millennials who married first and those who had a baby first. And in fact, regardless of their economic background or their ethnic backgrounds, a clear majority of young adults who married before having children had achieved a measure of financial success by the age of 28 to 34. On the other hand, having a baby first is associated with markedly lower odds that young adults are on the path to success. And overall, a large percentage of those who had a baby first never made it into the middle income bracket. Additionally, what was most interesting in the Wang and Wilcox research is that they found, regardless of race and ethnicity or income status as a child, that missing the steps led to an increased rate of poverty. In fact, 1/4 of young adults who missed steps 1 to 2, that is, they did not graduate or have a full-time job before having a baby, lived in poverty. And over half of those who missed all 3 steps were living in poverty. Sorry, went the wrong way. So if we know that the success sequence works, then the question is really, how do we incorporate the information from the success sequence into our programs in a way that makes a difference for the youth that we serve? By engaging youth in goal-setting activities, we help them to become future-oriented rather than background-dependent. We need to really work with youth to ensure that they can cast a vision beyond their current circumstances. And we have to provide opportunities in our programs for them to evaluate their own decisions about their future anticipated actions. The research shows that living life with purpose typically leads one to be happier and more fulfilled. And we can empower youth to work to live life with a purpose and on purpose. And that means that through our programming, we help them to gain the skills that they need to do what truly matters to them in alignment with both their values and their beliefs. And we help them to focus more on hopeful thinking than wishful thinking. And the difference there is really that hopeful thinking is goal-oriented and goal-directed, and it is an active process which helps the students thrive academically and personally. And it really is much more than just wishful thinking about the positive outcomes that they would like to have in their life. So research supports the concept that living with intentionality helps youth to thrive. If they are hopeful, they have an easier time being future-oriented, and they can begin today to prepare for tomorrow. So the success sequence really works because it helps teens to understand the possible consequences of their choices. It provides for them a roadmap for the future, an opportunity to evaluate goals, and it really provides freedom for them. So what I would like you to do right now in your chat box is answer for me the blank here at this first statement. What does the success sequence provide freedom from? And if you could just answer that quickly in the chat, your thoughts on what the success sequence provides freedom from. Stereotypes, I see poverty, misguided decision-making. These are great answers. Generational poverty, wonderful. And feeling stuck, I see freedoms from worries and stress of what the future holds. So let's take a second now, those are great, and think about what the success sequence provides freedom to. We had another answer here on the from as chaos. So free to success, reach your full potential, achievement. Great. So we can see that there are easy ways to work to help youth understand how the success sequence can help them reach their goals. And someone else here put, they're free, it's boundless, feelings of self-worth and pride. Great. So why then do we teach the success sequence in SRA programs? The success sequence is really a healthy option that many people don't know about. And so it's important for us to incorporate and expose our youth to these concepts. It helps them to develop a future focus. It informs them of pathways to economic success. And it really is, as I said at the beginning of this, a very important piece in poverty prevention. Furthermore, the success sequence really helps youth set goals and plan for safe and stable family formation. A healthy marriage, the research shows us, is a concrete example of stable, healthy relationship. And a healthy marriage provides a stable life partner to help with life's challenges, increasing opportunities for success for both partners and the children within that stable relationship. Research supports the concept that marriage matters. And if we look at the Fragile Families Study, which was a joint study done by Princeton University and Columbia University between 1998 and 2000, they followed nearly 5,000 children born in large US cities and studied those families, the mothers, fathers, and the children up to the age of 9. And they found that those who marry first and have a baby afterwards are 5 times less likely to break up than those who had a baby first. And the study also revealed that couples who were cohabitating prior to the birth of a child were 3 times more likely to break up than married couples. So that research really showed that marriage matters. Now, clearly, we have to understand that sometimes life gets in the way. And with dealing with youth, we have to acknowledge that for them. We really need to make sure that we are always non-judgmental and that the language we use doesn't imply at all that we are labeling persons as good or bad based on choices they have made in the past. If someone has already made unhealthy choices, they can always make healthy choices in the future. And so when talking about the success sequence and doing this in your programming, it's really important for the youth to understand that they can still accomplish their dreams, even if they haven't followed the success sequence, if they get themselves back on a path towards success. So we don't want to be directive. We want to be directive, but we don't want to direct. The youth need guidance in understanding how the success sequence can help them, but they also need to see that all is not lost if they have veered off course. And they need to be able to believe from within that they have the ability to get themselves back on a path to success. We need to help them understand that their priorities may need to be reorganized. Reaching their goals may be more challenging, and they may need to set a different set of sacrifices that they're going to have to make. However, we want to ensure them that we will always, in every activity that we do with them, get them to understand that they can make healthier choices. And if we do that, then we leave them with hope and inspiration, and they will thrive. With that, I'm going to turn it back to Melissa.
Thanks so much, Nancy. Okay, we're going to look again. We're coming back to this curriculum rubric, and you can see that the success sequence really speaks to the required topics of A, B, and C there. And you can see in this example, there were in this middle column, it was identified that there was a gap in, it was missing any conversation about the success sequence or avoiding poverty. And so that would be an opportunity and really would demand supplemental materials to be able to meet that benchmark. And so, listen, I understand that this is a lot to cover in 90 minutes, and we may have raised more questions than answers. You may be walking away with lots of questions, and that's okay, because again, this was designed to really just be an overview, kind of raise awareness of curriculum assessment and the process and tools that can be used to do so. And then we have planned opportunities for you to hear from each other, to learn from one another, and to get really hands-on experience in walking out what curriculum assessment looks like. So be on the lookout for those. Cindy will talk more about those opportunities in just a minute. So all that to say, we wanted to kind of just give an example of how to use a rubric, and then really quickly, let's do one quick assessment ourselves. So if you would share in the chat, identify one area that you, in the curriculum that you implement, identify one area that you think may need supplementation to ensure that you're really meeting all those required topics. And again, your responses will just come to us. It's not for everyone to see. So again, this isn't a punitive kind of process. This is an example and an opportunity for us to identify areas that we can improve, because we always want to be getting better. And your responses will help us really customize training and technical assistance that can really help you become better and better. So type those. I see some of those responses coming in. I encourage you to continue responding there to us, and we will use all of that feedback to improve the training and technical assistance that we offer. And so I'm going to hand it over to Cindy now as our moderator, to be able to field some questions that came in. And if you have a question that you would like to ask, make sure and type that in the chat.
Okay, great. Thank you so much, Melissa. We did receive a question, and actually you, Melissa, or Nancy could answer this. What do I do if I identify gaps or weaknesses? How do I supplement that area?
Great. Yeah, that's kind of the natural question after hearing about this, right? What happens? What do you do once you identify those gaps? First, again, that's the whole point. So that's a good thing. There's nothing wrong there. I would encourage, or just reiterate, that make sure you're using the most updated version of your curriculum. That's kind of step one. Step two is to make sure you're in communication with your curriculum publisher to make sure that they're aware of those things if they pop up, so that they might already have solutions for you, or they might work with you to help develop solutions. Once you've done those things, the next step would be to talk with your project officer to decide what kind of options you have there. And then also make sure you take advantage of the training and technical assistance that's available to you. That's why we're here. And we can help kind of come up with good solutions for strengthening those areas of weakness.
Okay, thank you, Melissa. We received another question. Lori, this is for you. What can we do if our curricula doesn't have information on STDs?
I think there's going to be several things to do to add, sort of supplement, to use the word Melissa used, what you're already using. Of course, CDC is going to be a great source for basic information, most up-to-date statistics that you can begin to incorporate into your curriculum, and then begin to look at other curriculum perhaps that you might be able to take a part or piece of to supplement to yours, would be my next step. And as Melissa said, turn back to the support available through the project officers and your granting association to get more in there. I think a lot of groups are looking for it, and if there's a way that our organization can help, where you've heard from Ascend and others today, to be a part of adding into that important content of STDs and STIs. So it's very concrete, but cdc.gov/STD will certainly get you started.
Okay, all right, thank you. Let's see, this one is for Benny. could they get more, where can they find information on consent per state?
The resource, the link that I used in my presentation, it is included at the end of this resource page. So if you go there, they'll break down all the age of consent and all the different laws for each state. So that's a good place to go. And you could just do a local research as well for your state. If you type in age of consent for your state, it'll just pull right up. Yep.
Okay. All right. Thank you, Benny. Nancy, this one is for you. How do we request technical assistance related to the A through F topics?
So the best way to do that is to reach out to your federal project officer and indicate to them that you're interested in some individual training and technical assistance on A through F. And they will send that over to us at Public Strategies and we will reach out to you. However, I do want to also say that the remainder of this series, this webinar, will continue to work on A through F. And we have a tip sheet that's coming out. We have a cluster call coming up. And then we have two separate workshops, one for new grantees and one for refunded grantees, where we will actually be sending you the rubric, very similar to what Melissa showed you. We will be sharing that with you and asking you to kind of work through a gap analysis. And in those workshops, we will be sharing both amongst grantees and with the moderators, helping you to figure out how to fill those gaps in your A through F.
Okay, great. Thank you, Nancy.
You're
I'm
welcome.
sorry we don't have any more time for questions. I would like us to move on because we have a lot of resources available for you that we want to bring to your attention. We have a slide with all resources for toolkits and rubrics. Let me keep moving on here. All right, resources, these are for rubrics and the conceptual models. There's a complete slide here with other resources regarding STIs, STDs, dating violence, sexual coercion, and then also the success sequence. In addition, I'd like to share with you, there are opportunities for continued learning, like Nancy mentioned. Watch, we will be releasing a tip sheet to extend your learning on ideas to incorporate these select A through F topics. And in addition to that, we will be hosting a cluster call on April 21st to facilitate a conversation amongst the grantees on practical strategies, challenges, and questions related to these topics, followed up by some workshops. So please stay tuned. We realize this is a lot of information that was presented today, but we are so glad that you joined us. In addition, we want to remind you that the exchange has a wealth of information on there, resources, the comment wall, events calendar, training opportunities, recorded training webinars, and then also, if you would like to request technical assistance, please contact your federal project officer to request that. We are here to support you in your efforts, and please feel free to reach out. In addition, we have all of our contact information here, myself, Melissa, Lori, Benny, and Nancy's, and feel free to contact us if you have any questions regarding what we covered today. We'll be happy to answer your questions. And again, I would like to thank you for spending the afternoon with us. I'd like to thank our presenters, fabulous job, and thank everyone again for being here today.
Thank you, Cindy, and thank you all for joining today's webinar. We appreciate your time and attention, and we sure do encourage you to complete the short post-webinar evaluation survey that will appear in a separate window when you exit the webinar. This will conclude today's event. Have a great day.